One of the biggest issues that we see with neuromodulators, especially when you go to somebody who maybe is more inexperienced, where people are like popping into med spas where it's just kind of like
especially here in Miami.
Yeah. Seriously. You see people get like ptosis where it drops their eye, or maybe their mouth looks a little bit, off because, they didn't hit the right muscle or something. What can people do? Well, first off, why is this happening? And should people be concerned about that? But second, the question is, what can people do if that does happen? If they do get like a dropped eye?
Okay. So what does it happen? A lot of it has to do definitely with technique. So where you're injecting it, these are very precision injections. We're targeting muscle in very specific groups. So that's why your injector needs to know exactly what they're doing when they're injecting, what their purpose is. And that's what we tell patients even after the treatment. Don't go rub that area because you don't want that diffusion to go into it. Nearby muscles that were not the targeted muscle.
For up to how many days after you get the treatment done?
So I tell them for at least 2 days and, avoid rubbing or anything.
Don't
or
get
getting
a facial
massage, pressure in that area. So that's something to keep in mind.
Okay.
Same thing goes with even exercise. I tell them to avoid it because when we're exercising, we're also engaging all these muscles, but also the blood flow right after the treatment as well can potentially increase our metabolism. So going back into things that can make it last longer or less. That could be one of them.
Oh, so then let's say it does happen though. Because I've even had the most experienced, amazing board certified plastic surgeon drop my eye years ago. This was years and years ago. I think like techniques were still being, I've been around for a while. So, like we were still testing out techniques and stuff, but I did get a dropped eye one time. And back then he gave me some eye drops, I remember, to try to make it go away. But is there anything nowadays? This was like over a decade ago.
Unfortunately, there's nothing to reverse the effect of the toxin yet. And maybe this is in the near future. I really hope so, especially with longer lasting formulations that we're having, like Daxify, that could last a little bit longer. I hope that, just like we have something to reverse filler, one day we have something to reverse toxin. It should these things happen, because if not, you just have to let it wear off on its own. And then what I usually tell the patient is, anything that would increase your metabolism, exercise more, move the muscle more, that would just make it wear off quicker. Yeah, for the eye drops is more to help with compensation of another little muscle that we have here. When you put the eye drops, you activate that muscle, so at least your eyelid looks a little more open. However, if you have a drop eyebrow, forget it, because that's actually different. So you'll have to live with that eyebrow
for at least 3 months.
Yeah.
It happens. It does happen. So it's more reason to go see somebody who is a professional, but it can happen no matter who you see, right?
Absolutely.
Yeah.